Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about social anxiety disorder. So in particular, we'll cover what it is, how you treat it, and how you can better live with it. So to start with, what is social anxiety disorder? So it's normal to feel nervous in some social situations. Going on a date or giving a presentation may give you that feeling of having butterflies in your stomach, for instance. In social anxiety disorder, everyday interactions cause extreme fear and self-consciousness. It may become impossible for you to eat with acquaintances or write a cheque in public, let alone go to a party with lots of strangers. If your life is disrupted by this kind of fear, you may have social anxiety disorder. So if you or a loved one has social anxiety disorder, take heart. Effective treatment, often with cognitive behaviour therapy, medication and positive coping skills, can improve the symptoms of social anxiety disorder and open up new opportunities. So, social anxiety disorder is a chronic mental health condition that causes an irrational anxiety or fear of activities or situations in which you believe that others are watching you or judging you. You also fear that you'll embarrass or humiliate yourself. Emotional and behavioural signs and symptoms of social anxiety disorder include intense fear of being in situations in which you don't know people, fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, and fear that others will notice that you look anxious. Anxiety that disrupts your daily routine, work, school or other activities, avoiding doing things or speaking to people out of fear of embarrassment, and avoiding situations where you might be the centre of attention. Physical signs and symptoms of social anxiety disorder include blushing and profuse sweating, trembling or shaking, stomach upset, difficulty talking, shaky voice and muscle tension, confusion, palpitations, diarrhea, cold and clammy hands, and difficulty making eye contact. You may also be affected by low self-esteem, trouble being assertive, negative self-talk, a hypersensitivity to criticism and poor social skills, worrying about having symptoms, so common everyday experience that may be difficult to endure when you have social anxiety disorder include using a public restroom or telephone, returning items to a store, interacting with strangers, writing in front of others, making eye contact, entering a room in which people are already seated, ordering food in a restaurant, and being introduced to strangers, initiating conversations. Social anxiety disorder symptoms can change over time. There may flare up if you're facing a lot of stress or demands, or if you completely avoid situations that would usually make you anxious. You may not have symptoms. Although avoidance may allow you to feel better in the short term, your anxiety is likely to persist over the long term if you don't get treatment. So next is, how do you treat social anxiety disorder? Treatment can help you control symptoms and become more confident and relaxed in social situations. Psychotherapy. So cognitive behaviour therapy improves symptoms in up to 75% of people with social anxiety disorder. First choices in medications. Several types of medicines are used to treat social anxiety disorder. However, the selective serotonin reuptake inhibitors, or SSRIs, are generally considered the safest and most effective treatment for persistent symptoms of social anxiety. And the SSRIs your doctor may prescribe include Seroxat, Lustril, Favorin, and Prozac. Other medication options would be, your doctor may also prescribe either medications for symptoms of social anxiety, including other antidepressants. You may have to try several different antidepressants to find which one is the most effective and has the fewest unpleasant side effects. Anti-anxiety medications, a type of anti-anxiety medication called a benzodiazepine, may reduce your level of anxiety. And beta blockers, these medicines work by blocking the stimulating effect of adrenaline. They may reduce heart rate, blood pressure, pounding of the heart, and shaking voice and limbs. Because of that, They may work best when used infrequently to control symptoms for a particular situation, such as giving a speech. And finally, how do you live with social anxiety disorder? At first, being social when you are feeling anxious is challenging. As difficult or painful as it may seem initially, don't avoid situations that trigger your symptoms. By regularly facing these kinds of situations, you'll continue to build and reinforce your coping skills. The following techniques can help you begin to face situations that make you nervous. Practicing these techniques regularly can help you manage or reduce your anxiety. Prepare for conversation. For instance, read the newspaper to identify an interesting story you can talk about. Focus on personal qualities you like about yourself. Practice relaxation exercises. Adopt stress management techniques and set realistic goals. And finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you managing social anxiety disorder more effectively on a day-to-day basis. So to start with, we have numerous products to get you started on an exercise program, such as exercise ball, floor mats, weights, and various other items you need to put a program together. We also have various supplements and products which you can purchase from us without a prescription, such as skipping ropes, pedometers, body fat monitors, and kava, valerian, vitamin B and folic acid, omega-3 fish oil and ginseng. We also stock light boxes to promote relaxation, blood pressure monitors and blood sugar monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During our telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing your condition with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.